I'm Andrew Eschenroeder. I'm one of the urologists here in the practice at Virginia Urology. I grew up in Lynchburg, Virginia. From there, went to University of Virginia for undergrad. Studied biology there. For a year afterwards, I went and worked at the National Institutes of Health. Worked in a research laboratory there. Following that, I went to the Medical College of Virginia to complete a master's program in physiology. Stayed on there afterwards. It was a consecutive 6 years and did my medical degree there as well. And then went to Wake Forest for my training in general urology. I think when I was finishing residency and trying to decide where I would go for work, Virginia Urology was already kind of known to me, just having trained in the area for medical school and knew the reputation of the practice. And as I went out and kind of saw what other practices were out there, Virginia Urology stood out to me in a lot of ways because of the culture. It's unique in a very positive way where it's very collaborative. I think there's a wide variety of expertise within the practice. And I think that it kind of speaks for itself that they have a great reputation of taking care of the community. In my practice, I do cover the gamut of general urology, and I'll see men, women of all ages. I do have particular interests in treatment of kidney stones and stone disease, and also BPH or prostatic enlargement. Those are areas of focus for me. I also have interest in reconstruction, prosthetic surgery, things like that, and trying to figure out what's going to be the best way forward for each individual. I do think it's really important to have a working conversation with a patient as kind of what their goals are, what's important to them. Each individual is going to have different priorities as they're coming in to see a urologist and what they hope to get out of the visits and future treatments and things like that. So I think it's really important to keep that dialogue open when I see a patient, and I think that gives us the best chance of getting everyone content at the end of the day. And I think a great thing about urology is that in most facets we're really able to do a lot to help, and it's a rewarding area to practice in.